Abstract. Since the emergence of coronavirus in China at the end of 2019, it has swept the world until it posed an unprecedented health challenge. Millions of people around the world have become infected, and many of lives are lost. From here, doctors began to consider the available drugs that have been available and be safe in many other diseases, with the possibility of having antiviral effect in order to control the infection. Among these drugs was Ivermectin, which is widely used to treat many parasitic diseases. The first clinical trial in this regard originated from Hegazy University in Egypt and recorded in May 2020. Great success has been recorded in preventing infection in family members who are in close contact with patients. Subsequently, many studies around the world began to use it in prevention as well as in treatment of confirmed cases. Despite the advice from WHO that ivermectin should only be used in clinical trials, the results of most of the previous studies were very encouraging. In this article, we report a case of COVID-19 virus infection treated with ivermectin along with some other drugs to treat the symptoms and avoid potential complication and viral infection. Introduction. As we said, with the emergence of coronavirus infection and the announcement of WHO of the spread of COVID-19 pandemic, many attempts appear to control it, including physical distance measures, wearing a face mask, and vaccinations. New mutations of coronavirus are still emerging and are mostly resistant to vaccine. Despite the emergence of many effective vaccines, it is still too early to know the best way or best one to control COVID-19 with any of them. In this regard, several clinical trials using the available drugs to treat COVID-19 patients have been investigated. Among these drugs, ivermectin, that has been previously used as a safe and cheap drug to treat several parasitic and skin diseases, has been suggested to be effective as a prophylaxis and treatment for the early stages. Our use is built on the previous reports indicating broad spectrum antiviral properties of ivermectin. Despite the apparent effectiveness of ivermectin as antiviral drug in previous studies, the WHO has not yet approved its use except in clinical trials. Case report. The case concerns a 29-year-old man who is a physician in isolation hospital specified to isolate and treat COVID-19 cases. He was suffering from a sore throat accompanied by sharp pain, headache, stuffy nose, frequent sneezing, coughing, tinnitus, shortness of breath, general fatigue, and muscle aches. He was investigated by PCR swab, which revealed positive case for COVID-19. Immediately, he was isolated at home. Then the course of treatment was started in addition to bed rest and plenty of fluids. Treatment included 4 tablets, each contain 6 milligrams of ivermectin as a single dose on an empty stomach for 4 consecutive days. Furthermore, a broad-spectrum antibiotic, levofloxacin, 500 milligrams, was given 1 tablet daily for 5 days. This was concomitant with antihistamine, antibiotic, and nasal decongestant tablet, 1 before bed for 10 days. At the end of the 10 days, the case was improved with relief of most symptoms and signs, except mild headache that was improved with time. Discussion. COVID-19 is a multi-organ disease that primarily affects the upper respiratory tract. At neglection of early management, it extends to many other organs. In our case, treatment was started as soon as the diagnosis was confirmed. This is important for the management. The positive response to treatment was well marked, indicated by relief of clinical disorders. Ivermectin was the main component as antiviral drug used in treatment of the current patient. In this regard, in May 2020, it was the first clinical trial in the world to use ivermectin to combat the current pandemic registered by Hegazy University. We agree the recent study that confirms high efficacy of ivermectin in early stages of the disease with early recovery of symptoms. Ivermectin is not only beneficial for its antiviral properties, but could also be due to proposed anti-inflammatory role in treating allergic respiratory conditions. In this regard, we also used antihistamine decongestant to reduce the congestive manifestation for ease breathing. We used small doses of broad-spectrum antibiotic to avoid any possible secondary infection that might occur due to increased mucosal secretion of the nose and the respiratory passage. Co-infection is a possible complication of viral respiratory tract infection, including SARS-CoV-2. Therefore, the use of antibiotic is a crucial factor to decrease the mortality in such cases. Moreover, addition of histamine H2 receptor antagonist famotidine to the protocol of treatment may reduce and manage inflammatory reactions caused by the virus. Common mistake in the use of ivermectin. A common mistake with ivermectin is its use only after the infection spread widely in the body and causing many organ failure. In this regard, we emphasize that for its use to be effective, it must be administered as quickly as possible for infection or even suspected infection when a person has been in close contact with the confirmed cases. Also, in many people may consider it as a vaccine that may provide long-term protection. Here we confirm that it is not a vaccine. This means that it should be taken every time you are exposed or suspected of having an infection when dealing with confirmed cases. Conclusions. In conclusion, we suggest use of ivermectin in the early treatment of COVID-19 infections. Furthermore, it is recommended to use prophylactic broad-spectrum oral antibiotic, antihistamine in combination with nasal decongestant tablets for ease breathing and to avoid possible complications. We hope this case report will assist in making appropriate evidence-based decision to help clinicians manage COVID-19 cases, avoid potential complications, and save lives. It is urgently recommended that further large-scale studies be conducted to confirm the efficacy of ivermectin against COVID-19 and to reach consensus on dosage and protocol for treatment. In this regard, we emphasize, according to our previous observation, that studies looking at ivermectin in the prevention and early treatment don't take time, don't consume time, and not forming a burden to the health or the economy. We emphasize also that ivermectin is not a substitute for vaccination. Effective vaccination are highly recommended for long-term protection against the coronavirus. However, using ivermectin in parallel with vaccine can help fight the current pandemic. It may be an emergency protection open exposure or contact with patient, or medication for patients who have become infected in the early stage, even if they have been immunized. These are samples of our previous trials and studies in this regard. Thank you. This my communication means for any inquiry or questions even later on. Thank you.